About 1 in 3 people will break a bone in their lifetime, and in most cases the bones go on to heal completely normally. However, in a small number of cases, about 2 to 10% of cases, the bone takes a long time to heal or never heals at all, and it's absolutely debilitating for the patients affected. We are now working with the University of Oxford to develop a method of delivering drugs to bone fractures using microbubbles and ultrasound.
To try and solve this problem, we are actually repurposing an agent that's been used in ultrasound imaging for a very long time. So these consists of very, very tiny bubbles of gas, about a few millionths of a metre. They're injected into the bloodstream and they produce really, really strong echoes when you have ultrasound imaging going on. The way it works is because the bubbles are full of gas, they're very compressible. So as the ultrasound wave passes through the tissue, the pressure's changing, so these bubbles expand and contract. So they act like tiny little loudspeakers, producing these really, really strong echoes. Now, the one problem with using such tiny bubbles is they're very unstable, so they have to be coated with a biocompatible material. And that's what allows us to use these bubbles for drug delivery. Because we can trap a drug between the gas core and the outer shell. The bubbles can be injected into the bloodstream, and we then use a very high intensity pulse of ultrasound to pop the bubble open at the target site and release the drug there. So we reduce the risk of the drug ending up elsewhere in the tissue and producing harmful side effects.
The concept of using microbubbles to aid bone fracture healing is huge. It represents an enormous cost to society, and if there's any strategy to improve and shorten the duration of the fracture, then that's hugely advantageous. In this study, we've recruited 8 patients who had fractures of their upper arm, their humerus bone, and we've injected commercially available microbubble solution intravenously, and we've demonstrated that these microbubbles do aggregate around the fracture site.
In the lab, we are looking at how various fracture shapes impede ultrasound and the triggering of microbubbles. To do this, we're using computational analysis as well as using real pieces of bone tissue which we place inside an ultrasound device. This ultrasound device consists of a large water bath with an ultrasound piece at the bottom, which allows us to propagate ultrasound through a piece of bone tissue or bone cells and look at how microbubbles interact with the tissue. We are also looking at what effect microbubbles loaded with the drug have on pieces of bone tissue and on bone cells.
The potential impact in trauma and orthopaedics is potentially huge, in that we could potentially load these microbubbles with bioactive substances to aid or augment bone fracture healing. We could also use it to deliver antibiotics, in particular for people who have bone infection. Our plans going forward are to start loading the microbubbles with various agents to see if we can improve the time to healing. And I think further down the line, it would be interesting to also look at the effects of antibiotics as well in people with infection.